and gentlemen, welcome to the Nutrition Hero Podcast. Igniting both the art and the science of functional medicine. Here's your host, Dr. Brad Watts.
Hello, Nutrition Hero family. This is Dr. Brad Watts in the podcast lab. As always, thank you for joining me today for this episode of the Nutrition Hero Podcast. Today's episode is an interview with a gentleman named Dr. Skylar Pond. You can find him at Sports Medicine Northwest, out in the upper northwest of the United States, and sportsmednw.com, sportsmednw.com. And today we're going to be talking about a topic that he is very familiar with, and I definitely enjoyed the conversation. Strength is medicine. Strength is medicine. So, all right, buckle up. Here we are with Dr. Skylar Pond. Dr. Skylar Pond, welcome to the Nutrition Hero program today. I appreciate you spending attention with us. How you doing?
I'm doing great. It's really good to be here. Thanks for having me on.
Yeah, I'm excited for our conversation. I've been following what you're doing, and I appreciate the passion that you have. And so I was like, dude, we got to talk. So this is good.
Yeah.
So where are you at, by the way? What part of the country are you in?
Oh, we're way up in the Northwest. We're in West Seattle, which is progressively becoming more and more of an island. We have the bridges went down right along with COVID changes, and we have all of the best programming minds all just stuck in this island working from home now. It's an interesting scene here, but it's a great place to be stuck if you have to be isolated.
Yeah, well, outside of downtown, right? So when we look at what you've been doing and spending attention on as far as your practice is concerned, one of the things that just struck me is your dedication to fitness and movement as part of healing for people. How long have you been involved in this movement that you've been making?
Well, that was the background that I came from. So I've been in practice 12 years now, and it's certainly progressed and evolved from the early stages. But that was my background. I was, like a lot of people in my kind of a profession, I had that kind of defining injury and experience as a young person, and wanted to figure out ways to overcome my own limitations. And then I had success with that. And then it's been the mission to share that with as many people as possible. But over the last, I'd say 3 years, we've kind of changed gears and become a little bit more integrated, where it was all just manual therapies and guidance on basic nutrition and corrective exercise and strength training with manual therapies. Now we've really evolved and brought in far more expertise on the nutrition side, and brought naturopaths and nurse practitioners onto the team here. So I feel like every year or so, I feel like I'm on a new angle, a new mission, and I think that's wise. I try to keep the foundation of what I've got, but keep my eyes open for what's most relevant and what's most exciting for me, for one thing, and it's been useful for me, and then try to share that with my patient population.
Well, I appreciate that, because that sharing, that education component to it is something that's missing in modern medicine today, and it gets filled by the media. And so what happens, in my opinion, is you get the professionals telling the media a bastardized version of reality, and then the media bastardizing it even further to the public. Right. And then all of a sudden people are like, yeah, that fitness stuff in for me, it doesn't work the way that everybody says it does.
Right. And it's even worse with nutrition, right? Like, okay, now eggs are in, now eggs are out, coffee's back. It's just blurring the line of science and reality, where people just kind of shrug their shoulders and do what feels right, unfortunately. Right.
That's right. I do that with my wife. I tell her, hey, honey, eggs are bad again, just so you know. And
you just hear a dozen smash out of the kitchen, I'm sure, right?
That's right. One of the things that you have as a mantra, as like part of your branding, is strength is medicine. And I think it's a really powerful message, just in 3 words. And I want to talk about that today. I want to unpack, what does that look like in chronic conditions, chronic disease? And there's this thing where you have, like, health is all in a continuum, right? You have, before you have disease, you have dysfunction, and before there's dysfunction, hopefully there's some level of wellness. And then past wellness, in my opinion, is this thing called fitness. And like wellness is being able to cope and maintain health in like normal circumstances, but fitness is like being able to maintain health in extraordinary circumstances that you put
Right.
yourself into. And I think strength is medicine kind of dovetails on that.
Absolutely. Yeah, I'd agree with that. For me, what that represents is trying to make the process active for my patient population,
Mhm.
where I'd prefer if someone doesn't come to me and look for 100% of the answers and the solutions in a passive way. Like here's your supplement, and here's your 37 spinal adjustments, and here's your massage. Come in forever and I'll prop you up forever. Some people gravitate that direction, but I always leave the door wide open to taking ownership of whatever we do manually for someone. I want them to have a strong understanding as to why I'm doing it and how they can perpetuate themselves and grow independence and grow their own neurologic pathways around what we've done for them, right? And in some
Absolutely.
capacities, that's the strength component. I go to that strength as medicine. Well, back when I started that brand up, I was competing in strongman a lot, and that was,
Hmm.
I always dovetail my passions with my work. That way, I don't have to fake it. That's nice.
Right.
Um, and I've kind of transitioned out of that. I'm 41 now, but I'm still in the competitive role. But now I'm competing in Brazilian Jiu-Jitsu.
Mm.
But it still is relevant, and it still is important to our philosophy, where we're trying to kind of gamify the process of health and wellness, where barbell strength is the simplest game there is. You do your work and you get to improve by 5 pounds next week, and you have
Right.
that quantifiable feedback, that objective feedback, where you establish that connection between work and reward. And I don't care if my patients are or become powerlifters. It's a very small percent of my
Sure.
population that is, in fact, very small. But I try to share that kind of game process with everyone, where they take their focus off of the sound their knee makes when they squat and rise, and try to take their emphasis off of their body weight, and I turn it into how many times can I do this single leg squat
Yeah.
before I fail, and give it something that they can pursue in a day-to-day basis, that gets that little dopamine response that otherwise people are kind of turning to Facebook and Coca-Cola for. Try to kind of
Right.
tap into that from just simple strength and performance, and day-to-day kind of game
Yeah.
theory. Yeah.
So the thing with game theory as it relates to healthcare, especially fitness, is that what it does is it takes you to the edge of what's comfortable.
Hmm.
And when people are willing to do that, in my opinion, most of the time they're willing to go after their health goals. When it comes to like somebody that says, I want to reverse my diabetic condition, or I want to lose 50 pounds, or,
Right.
I want to make sure that my mental health is where it needs to be, this next quarter, different than where it's been in the last quarter on people's lockdown and stuff like that. When there's a game attached to it, I feel like instead of looking for the negative, like in a fear context, you're looking for that failure, that negative, just to see what your limits are like. Like you mentioned with that
Right.
single leg squat versus saying, "Oh, my knee creaks," being like, "Wow, my leg doesn't work after doing 12 of those." Right? It's like you
Right.
come up to that
Right.
barrier really quick, and it changes your mindset toward what's possible with the body. So like you, I know you have been a CrossFit guy in the
Hmm.
past, and
Yeah.
that's where my passion is. Like I love CrossFit. That's my thing. I have there's a gym sitting next to me here,
Yeah.
and like that's the thing. And so when I look at that, like what CrossFit is, it's abusive. It's abusive, but it's
Yeah.
abusive. It's abusive with a purpose. Like Facebook's abusive and it's unending, right?
Right.
But like CrossFit, it's a controlled environment. There's a limit to it. Like any type of fitness, going on a walk, it's a controlled environment. There's a limit to the abusiveness, and I think that always pushing up to that limit, there's something there. There's something there as it relates to health and healing. In your experience, what have you seen with fitness? You said you prop people up. You're willing to do that, but you also leave the door open.
Right.
What have you seen as far as the differences between people that walk through that door to responsibility
Hmm.
versus people that just stand, in your services and they're like, thanks for taking care of me, doc. That's all I need.
Well, there's a difference between growth and maintenance, right?
Mhm.
Those who we prop up, I'm reluctant to say, well, if you're coming in 5 days a week, we could really make some real progress here. We just it all depends on their buy-in, what they're willing to put in, what they want to get out, and I leave both those options open. But certainly those who take ownership of the process themselves and are willing to invest a bit of time and energy to try to get that effort and reward, those are the ones who we graduate. We graduated from that knee creaking problem, and now when they come in, now we're looking at something else. Like, okay, now I'd really like to work on my range of motion through my hip. But okay, now let's kind of give you something to dig into there, and then with that we get to work through a series of small functional changes. Usually is what I'm looking for. That when we look back on it, do a re-exam every once in a while, we're like, oh yeah, remember that thing that you had with your neck? It's like, oh yeah, that's the kind of outcome that we'll get when someone is more engaged in the process themselves. One of the barriers, as you alluded to, which I think was wise there, was realizing that there is kind of a failure built in. There's an abuse built in a little bit whenever you're pushing up against your own personal barriers. And it reminded me of a conversation I had with a patient yesterday, an older gentleman, great guy. Met him in CrossFit. He's going to be 80 in October, and just as strong as can be for this demographic, right? But
Right.
with COVID and being locked away from society and in the gym and everything, it's really difficult. And just getting him going with some shoulder strengthening, and I gave him some difficult things, just really leveraged the heck out of him, and he was discouraged. He's down. He's just, well, I used to be strong. This was good. And it's hard to remind him that, hey, that was the point. The point was not for you to have comfort here. You have to get that out of your system. You have to reach that point of fatigue and failure at some point in order to get there. Just like when you're on a bike ride, when you're on a run,
Right.
the point was to get tired. That's okay.
Right.
You have to convince your body that what you're doing before was insufficient. So your body has to adapt. We're too efficient to just adapt because we want to, right?
Right.
We have to kind of give the body some kind of a signal that it's not safe not to adapt.
Right.
If we don't put down some more skeletal tissue here, this guy's going to kill us, right?
Right.
That kind of a concept,
Right.
and the body will shift its focus and its resources into that avenue.
That's
Yeah, so with strength and rehab, it's very, very intuitive to get into that lane. Once I kind of flip the switch and drop the shame of failure and kind of understand that that's the process that we're seeking.
that's interesting. Drop
Yeah.
the shame of failure. There's
Mhm.
a man, that's really interesting. So just talking about that, the built-in failure of going to the gym or participating in a CrossFit program or any type of exercising program. It could be a walking program on your app like Couch to 5K. Like just the built-in failure mechanism there is interesting to me. And the reason it's interesting to me is that that mechanism, we run up against that in the nutrition world all the time. People failing on their dietary programming, or like they
Right,
fall off the wagon for some reason.
right,
And how come that failure is different than like going to the gym? My goal is not to go to the gym and be like, hey, everybody, look how strong I am. My goal is to go to the gym and to find my endpoint, the barriers. Like, how far can I go before I can't do it anymore?
right.
How come it's different in the nutrition world? Like, just throwing it out there.
No, that's a great question. Well, failure in the nutrition world isn't like failing out on your max set at CrossFit. Failure in the nutrition world is failing to show up or pay your gym dues, right? Like you failed to stick to your program, and you have some built-in shame and fear avoidance built into it, so you don't want to think about it at all, right? So I think with that sort of a mentality, it's important to find those small victories and try to think of them positive. Meaning, I might change a program for someone where we're not trying to eliminate a behavior, with someone who has that kind of tried and failed kind of attitude. We might go with additions to, right? That way, every time you um, take X supplement or get an additional amount of sleep, then you had another success, another win, something that can't be taken away from you,
Mm-hmm.
right? But I think that that is the danger of nutrition counseling for me. I'm not great at that. In fact, I was really into paleo counseling and nutrition counseling because it was so successful for me with my patient population. I did that for years.
Yeah.
But it's so emotional for people, you know. And I found myself in a room just doing consultations, finding out how things are going with a nutrition plan for someone, and the patient began to cry like a lot.
Yeah.
And I have since moved away from that world. I realized that with nutrition, the information isn't nearly as valuable for my patient base, at least at that time,
Mm-hmm.
as the emotional piece of it. Right, the information they needed could fit on one half of one postcard.
Right.
And then after that, it's all these layers of emotional adherence and guilt and childhood relationships and so many elements that I felt unequipped to help with, right? So I have shifted more toward an objective assessment kind of a style here,
Right.
where my naturopath will try to get some useful insights, things that you wouldn't know about yourself otherwise. We use gut biome testing and some genetic allele testing, and some blood draw testing. That way the patient can realize, yes, I like beer and I like pasta and I feel bad about it, but that's not what our tests are revealing. It's like, well, did you know that you should also stay away from hazelnuts? And they're like, hey, I can do that.
Right.
That's new. I didn't like radishes anyway. And give them a
Right.
new checklist to work from. You know what I'm saying? And I think that has some opportunities to kind of get a fresh start, to kind of be a white belt all over again, and take a swing at some low-hanging fruit and have some easy success. And that's something that I encourage both in physicality and in other elements of lifestyle.
The thing that you mentioned there with the emotional layers and how deep these issues for people can go, I mean, it's generations. And you know, the fact that you pass DNA on to children and they pass it on to their children, your DNA is just an encyclopedia of experience. And it's this thing where most of the time I don't think people even understand where their emotions are coming from. In fact, I know they don't most of the time. But that's what I like so much about incorporating movement and fitness into what you're doing, because there's something about physical stress that pulls out all of that trapped in your body, like anxiety and stuff that's in there, especially with chronic disease population. There's something about that. And so just like reading again, Strength is Medicine, there's something to that, man. When you talk about that, laying down an effort where you know you're going to fail, that's the whole point of it. Laying down, and as long as you're giving your best, it's an accomplishment. The problem with nutrition is when people fail, I think they intuitively know they failed because they weren't giving their best. Right?
There's a lot of guilt, and there's a lot of fear avoidance behavior with that, right? You can't just beat yourself up all day long about your generational chronic disease, and you're aware that you're not making the healthiest decisions, and there's only so far that kind of bad dog no biscuit can take you with that. And it's true that we can try to disrupt some of these patterns through physicality. A lot of the stress responses that you see, some of the best research, the most consistent ways to address stress, anxiety, depression, it's always quite simple, isn't it? It's always exercise and exertion. And I think that taps into some old, wonderful caveman instincts of ours when we feel these stresses build up, say for, 3-4 weeks in a row, our brains are saying, move the village. There aren't resources here. There are too many predators. Break down the cabin, pick up and get to the other side of the river. Like, we're getting all these signals that manifest in our body physically with increased energy. Heart rate will go up and blood pressure will go up. Blood glucose will go up. We're ready for immediate activity. Our body's saying go, go, go. But unfortunately, in this current society and climate, it's not time to break down the village and move.
Right.
It's time to open up those letters that you've been postponing. It's time to
Right.
pay the IRS. It's time to do these things that will weigh down on someone in a way that gives you immediate fuel for activity. But by doing those things, it doesn't ever quite check the box. And that's just my personal theory, that the reason why it's not a pathology for all these numbers to go up. It's a healthy response to a pathologic environment, that our body needs a physical proof that we moved away from the stress. So even though paying the IRS was the stressor,
Right.
running a 5K will address the physiologic pathology that's brewing. So, and that can be enough to kind of break that stress. It's hard to make wise decisions, long-term decisions for yourself when you're in that fight or flight mode. That's when your whole body, your whole physiology is telling you, get immediate fuels. It's time to take action. So you can get some space from all those alarms that are being sounded just by that little simple genetic hack. If we're saying it, hack is a little bit overplayed, but a genetic understanding and manipulating that genetic understanding, that all those systems are telling us to make unhealthy decisions. Like a Slurpee might be the perfect fuel before moving your family away from a war-torn area or a tsunami or what have you, but it's not the perfect fuel for dealing with several years of cubicle lifestyle and built-up stresses. So I think that's a useful tool to break some habits.
Yeah, I think it's interesting that how mental stress, emotional stress can absolutely fatigue your body, but it's a different kind of fatigue than, I'm going to go do a bunch of squats over here or burpees or push-ups, whatever. It's a different type of fatigue. And there are different pathways for what is triggering that fatigue, whether it be like exhaustion of, glycogen stores or spending blood sugar versus, my cortisone's through the roof for like a decade. And that's why my body's tired. There's the different mechanisms there are things that I don't think patients understand, because most patients don't know what it feels like to be in a strongman competition, like you mentioned. Most patients don't know what it feels like to roll on a mat and, be grappling with somebody with skill. Most people don't know what that feels like. So when they're like, you want me to exercise? Are you crazy, doctor? You psycho? I'm already tired. What do you think's going to happen?
Right.
They don't know the different viewpoints or variations that show up as a result of that exercise. So that's interesting to me.
Well, anyone who's been through a finals week understands how draining, physically draining, memorizing and reproducing our articulate thoughts on several chapters of information is. Your body is actually wiped out. But who knows, all the other cortisol stresses and the fear responses and all the caffeine and all of that, they all compound together. But I try not to encourage people to get into a strongman competition. That's just going to be another another thing I failed at. Thanks, doc.
Scale is a thing, right? Scale is a thing.
I go with just a simple muscle burn usually when I'm dealing with someone with multiple level facet arthrosis and disc herniations and arthritic knees, maybe some replaced joints. I have a diverse community that I work with here. We'll start off, rather than giving someone 5 sets of 12 clamshells with this breathing exercise. There still is a place for that for some people, but I find that there's a perfect balance I need to strike. It has to be hard enough to be satisfying. It has to be easy enough that you can do it while you're planning your day, right? So for something like that, I might just say, there's a magic number 30. It might just be 30 clamshells. It might be 30 hip extensions. You do CrossFit still. That number 30 is magical. 30 American swings is not the same as 29 American swings, not in my opinion. There's something special that happens at the number 30. It's a burning kind of a lactic response that's special and right there. And that's where I try to lead someone off and let them have that satisfaction, pushing through a little discomfort and having the satisfaction of, oh, you mean I'm done? Yeah, you're done. You just did 30 seconds of rehab exercise and you're done. You haven't put your posterior chain through something like that in many years. Go recover. Good job. That's what's up.
Right.
And that's a great kind of concept and introduction to the way that you can tap into to people who are a little bit more extreme.
So when it comes to lifestyle, in your opinion, what are some of the main things that are driving the chronic conditions that are walking into your practice right now? Like, what are some of the main things that people are experiencing in their lifestyle that they can work on without having to be told, this is what you need to work on? Obviously, stop eating so many hot dogs, right? Stop drinking
Right.
so much Diet Coke, whatever it might be. What are some of the things that you see in your environment?
Well, me having a background as a sports chiropractor, I have a very diverse team here, so it's an integrated medical
Yeah.
clinic. But I'm always starting off from postural issues and postural problems,
Mm-hmm.
and that's built in, right? That's built into the modern society. Everything about this world wants me folded up, folded in, and down. That's not new information for anybody, right? Everyone knows that. And there are correlations to morbidity and mortality through this accentuated thoracic curvature.
Right.
This kyphosis, and the research shows that you'll live a longer, healthier life if you don't have this kyphosis compressing the chest cavity as you age. That's a huge piece, and it's very difficult to work with in a traditional way, because again, we're tapping into people's, I know my posture sucks, I'm bad, I try to hold myself up for like an hour a day, and then I just cave in, and then once I think about it, I'm like, oh well, I blew it.
Right.
I'm just going to go into dopamine mode. What makes me feel good? Diet Coke. Like that Dr. Pond made me feel bad about my posture. Now I need
Right.
something to bring me back up. I've got emails to answer. I've got bills to pay. Let's go. So
You're the reason why there's Diet Coke, right?
yeah, I did this. Sorry about that. But you have to be careful. You can't just make broad proclamations of things that people already know. What I prefer to do, and this spills over into my philosophy for the other elements as far as exercise, nutrition, even family life and behavior and emotional well-being, would be to find something that's powerful that you can do in the short term that will impact your behavior going forward. So for instance, with that sort of a diagnosis versus trying to get somebody into a more upright positioning, rather than tell them they should sit up upright, we're going to give them corrective exercises, something they can accomplish in ideally a couple moments that will empower them to know that, hey, I can slouch however I want for the next hour as long as I did my thing.
Right.
And now my body's going to have some momentum and run forward with that. And you don't have to push that boulder up the hill. You know what I mean? Whenever you ask a patient to push the boulder up the hill, I find that when I'm working with my athlete population, because I'm a team physician for Ivan Salivary MMA, and I work with pretty extreme people. Work with the pro rugby team here in Seattle. These people are highly motivated. They'll push the boulder. They'll do it, at least until they retire. And then you got a different story. But for everyone else, it's important that we're able to kind of push the sled a little bit. The forward progress won't go away if you forget about it for a week. And you can come back to it and keep moving forward.
That's right.
Yeah. So that's a common link for so many of the chronicities that we see, whether it's nutrition, activity, and kind of psychological well-being, people's willingness to kind of throw the towel and put it out of sight, out of mind, because it's kind of a negative feedback loop that they find themselves in.
I think it's interesting also that the way that the posture works, how it responds to activity versus the stresses of lifestyle. It's almost, at some point, you just end up bowing to your lifestyle. And that's what's happening over time, is people are just curving forward. They're bowing to the pressures of the life that they're living. Yeah. And it's sad if you think about it in those terms, because they don't have to. Like, you talk about forward progress doesn't stop. It doesn't have to stop if you leave it alone for 4 days. You can always come back, right? And the thing with that is that it's too easy to give up. It's too easy to give up. And like, that's the mantra that, as a chiropractor myself, as a functional medicine provider, and somebody who focuses on helping people with chronic disease, that's my thing. It's too easy to give up. you didn't come here for me to tell you to give up, right? It's
Right.
too easy for you to just lay down and be like, yeah, I'm done. Like, you're 60. You're not done. You have like 40 years
Yeah.
left. Let's get after it, right? It's just interesting mindset. So,
Yeah. And I find that we just need to try to find that commonality where someone has, as I was kind of alluding to before, that low hanging fruit, something that an opportunity they have right in front of them, something that they can see something, an objective return on their efforts. What we're usually working with here at my clinic is trying to build people's resilience, regeneration, their ability to recover, right? Especially from the perspective of an athlete. They're going to be recovering from their workouts, or they're going to be recovering from their injury, and that's why they came here in the first place. And in that sort of a situation, they've got a goal built in, right? I've got to recover from this to get to where I need to be. So that's the kind of window that I try to get other people to share with. Just like, just give me a 30-day buy-in. Let's just get you 30 days. Like we might do a Whole30 challenge with somebody, something like that, and just sign off on this. Just give me 30 days. Let's see what we can accomplish, and that'd be something that's kind of a buy-in. But it's so critical. It's so critical that we address all of these lifestyle factors. What I've found the more I practice is that I can do the same protocol for two separate people and get totally different outcomes, right? I'm sure you've noticed this, right? You have your heavy responders, your high responders, and you also have these kind of non-responders, low responders to the same therapies, the same interventions. And what we're trying to do through what we're doing with our exercise, what we're doing with the nutrition interventions, what we're trying to do with assessing people's hormones, things of that nature, is just trying to get everybody into that high responder category. Try to create a microcosm where your lifestyle reflects that of what we've observed of those who get the best results, the best response. And then we take those people who fit into that kind of high responding demographic, and we want to put them into this exceptional, like Yelp review kind of demographic,
yeah,
right?
right.
So I guess that's how we go about trying to explain the whys, right? Because
Yeah.
everyone has their why they would want to stick with this their whole life. I'm not going to share anything new with them as far as that goes, but when I let them know, hey, you just made an investment. Maybe you're doing PRP injections here at the clinic. Maybe you're doing the working with acupuncturists, massage therapists, and doing a whole nutrition overhaul. If you want to get the results that we know you want to have, then this is the pathway. This is the work that you do to make your body a little less busy. Everyone has this kind of, I think, probably the same regenerative capacity. Some people heal really well from injuries. Some people just stack up chronic conditions one after the other as they never fully heal from any injury. And it's what I've observed, and it's kind of our guiding philosophy right now, is that we just need to clear the plate. And what we have is this regenerative capacity, this healing capacity for the large part of the population is just spread way too thin. It's working on repairing the gut lining that's constantly under assault. It's repairing the skin that's always broken down and not cared for. It's repairing the ligaments that are always under stress with posture. It's repairing the endocrine system that's always under assault with too many stresses. So if we can get that plate cleared, and then you just have your stem cells, your native stem cells, just kind of hang out in the bone marrow and hang out in the vasculature and looking for a job to do. Then if we do a PRP injection into an arthritic knee, then you get 100% of your body's attention just focused on this point. And then they're in that high responder camp all of a sudden. So that's a great way to motivate people here in that context, because boy, they've got skin in the game,
Absolutely.
with a program like that, it's probably a cash service, and they want to make sure that they're not just wasting their time and money. And that we've had some great kind of kickstarts to lifestyle and health and injury recovery within that context. And that's just a number of different carrots hanging out there for them to chase, and that's very satisfying work.
That's cool.
Yeah.
I like the clearing the plate
Mm-hmm.
image there. I think that's important. One of the courses that I get to teach around the country is about how to turn on and off stem cells with nutrition. and
Oh
clearing
yeah.
the plate. I might have to borrow that term from you.
Oh yeah,
That's
use it.
awesome. Anyway, interesting. Doctor, I don't want to take any more of your time here today, but I very much appreciate hanging out with you. Thank you for your attention and for some of the knowledge
Oh
that you
yeah,
dropped.
absolutely, my pleasure.
Awesome.